Good afternoon, everyone. We'll go ahead and start the webinar in just a minute. We'll let a couple more people roll in.
Yeah, tricky lighting, Brianna. I just saw me disappear into the darkness, and then I emerged from the darkness.
Yes, welcome your speaker.
Yeah, I don't know if that's good or bad. You know, he emerges from the darkness to give a webinar. That doesn't set necessarily the right tone.
It's got a comedic beginning.
Yes, it does.
All right. So there's just a couple more people, and then we'll go ahead and get
Yeah,
started.
we'll give him a minute or two.
All right. All right. Well, good afternoon, everyone. Thank you for joining our webinar today. This is part of an ongoing webinar series exploring the practical applications of culinary medicine and taking it from the classroom to your kitchen. My name is Brianna Niekamp. I'm the online marketing coordinator at the University of Montana, and I will be helping facilitate our session today. Just to give you a brief overview of what to expect, I'll introduce our speaker, and then we'll get into exploring some fun topics of the day. If time permits, at the end of our session, we'll open the floor for questions. But if you do have a question, please put it in the chat box at the bottom of your screen and enter your question there, and we'll do our best to get to all your questions. So without further ado, I'd like to introduce our speaker. He's a cardiologist, professional chef, author, and college professor. Please welcome Dr. Michael Fenster.
Thanks, Brianna. Ahoy, Nation. Thanks so much for taking time out of your schedules to join me today. We have an exciting program, I think a very important topic. And as Brianna said, we're going to change it up a little bit today just because I think the topic affects so many people and there may be so many questions. Normally, we ask you to hold your questions till the end or go ahead and submit them on the chat. But today, if you have a question that comes up as I'm talking about things, as I'm showing some slides and information, please feel free to just go ahead and type in your question on the chat box. And at appropriate times, if needed, Brianna's just going to go ahead and read your question, and then I will go ahead and answer it. And if we don't get through the whole presentation, that's not going to be a big deal. We're just going to continue this. We'll just make it a two-parter and pick it up next month, next month's webinar. And as always, if you have anything in particular that you would like to see us address in terms of culinary medicine, whether it's something like today's topic, which is culinary medicine, diabetes, and diet, or in terms of culinary medicine practical applications. How do I make this? How do I do that? How do I source? Feel free to let us know. Just send me an email at the website chefdrmike.com. That's www.chefdrmike.com. If you follow me on social media, you can send me a question or a request there as well, and we'll get back to you. Also, as Brianna mentioned, I do teach the Introduction to Culinary Medicine course at the University of Montana. And we also offer this course, which upon successful completion awards a level 1 certification in culinary medicine from the university. It's a course that's 100% available online. It's completely self-study at your own pace, designed for everybody, because I'm a big believer that culinary medicine ultimately is about empowering the individual. So it's for each of us, and each of us has to be able to use it. So with that in mind, please do go check out the website, follow us on social media for all the latest tips. And I'm going to start talking a little bit about today's topic, which is culinary medicine, diet, and diabetes. And so to do that, I am going to attempt to switch and share a screen here. So please bear with me while I do that. And I'm going to pull up my screen here. And Brianna, if you can let me know if you see that, that would be very helpful.
You're good to go.
Okay, great. So a great place to start in terms of talking about diabetes is with a definition. So this one comes from a place we've probably all heard about, the Mayo Clinic. And what we are talking about when we talk about with diabetes, specifically today, there are two types of diabetes, but I'm going to talk about something called type 2 diabetes. And whenever we say diabetes, this is usually what we're referring to. And as defined by the Mayo Clinic, type 2 diabetes is an impairment in the way the body regulates and uses sugar or glucose. And glucose is a simple sugar that is one of the body's primary fuels. So whenever we do eat something, and we obviously need fuel to fuel our cells, fuel our bodies. It's broken down into different compounds. And one of the main compounds that is utilized as a fuel throughout the body is glucose. And one of the important terms that's in this definition is this long-term chronic condition results in too much sugar circulating in the bloodstream. And I want to draw your attention to long-term and chronic. So this is not something that just happens overnight, and it's something not something that just goes away the next day. So we're talking about a chronic disease and a chronic disability. And when we look at the major challenges we face in terms of our individual health, health as a nation and a society, it really is these chronic disabilities and diseases, obesity as manifested as an inflammatory disease, diabetes, which we'll talk about today, heart disease, inflammatory bowel diseases, autoimmune diseases. Um, we also talk about things that affect mental health, like depression, conditions like Alzheimer's, and other neurodegenerative diseases as well. These all are related to a chronic, ongoing inflammation. And as the Mayo Clinic says, eventually having this sugar, these high sugar levels floating around all the time leads to multiple disorders. And so that manifests in type 2 diabetes in really two particular manifestations. So, first, what happens is that the cells basically ignore our body's signal to them to take up the glucose and use it in the cells and get that fuel out of the bloodstream and into the cells where it can be used. Basically, these cells like become all DMV workers, and they just ignore the massive crowd of glucose that's floating around them, and they're like, yeah, glucose, meh, whatever, and they just don't respond to it at all. And this is one of the characteristics of type 2 diabetes. This is known as insulin resistance, meaning the cells of our body become inured, they become resistant. They just don't listen when that insulin is in the bloodstream, telling them to take up this sugar and use it. So, what eventually happens is that our body responds, our pancreas, which produces insulin, responds by going ahead and making ever more insulin. So those insulin levels start going up in our body as our sugar levels do, as those glucose levels do. Eventually, towards the tail end of existing with type 2 diabetes, what can happen is that the pancreas sort of burns out and it doesn't really produce enough insulin. And then you have a double problem in that your body can't produce enough insulin, and the insulin it does produce is ignored by the cells. This is very different than type 1 diabetes, something we used to call juvenile onset diabetes, in which people are born, often born with a genetic condition in which their pancreas, for many reasons, just doesn't make enough insulin right off the bat, but they don't necessarily have this insulin resistance that's such a hallmark of type 2 diabetes, which is also known as insulin resistant diabetes or sometimes adult onset diabetes. So, understanding what the pathophysiology is and using the Mayo Clinic definition, what does that really mean? Well, what it means for us in terms of dealing with diabetes is that what's important here is it a systemic, whole body state of inflammation. So we need inflammation, although we often hear so many bad things around the term inflammation these days. We need inflammation to protect us from things like a COVID virus, inflammation when we hurt ourselves, when we cut ourselves, when we break our bones. There's an inflammatory response that helps us heal. So inflammation is an important part of our state of being. Um, and normally we like to exist right in the middle. So if you can put your hands in a sort of a little prayer shape, and your left hand would be kind of your inflammatory system, and your right hand is the counter state, kind of an anti-inflammatory system that controls it. If you put your hands in a little prayer shape, that's where you want to live, right in the middle. And that's something we call a eustasis, a homeostasis. It's a state of just balance and harmony between just enough inflammation but not too much. Well, what happens in diabetes is if you just take your left hand now and just kind of push it like you're doing the old Egyptian dance there, and push your right hand out, we get skewed into a state of ongoing chronic low level inflammation. And this affects all the systems in our body. So it affects the cardiovascular system, all our vasculature. It affects our kidneys. And with this pro inflammatory system comes high levels of what we call catecholamines, which are the common term might be stress hormones. So your body starts living in this constant state of stress. And a great analogy is that, particularly if you live in Montana, you know that it is a wonderful thing in the middle of a Montana winter to be able to turn on your thermostat and have it set at 65 or 70 degrees. That is wonderfully comfortable. And that's kind of how our body's inflammatory system works. The bad part is in diabetes is that that thermostat is broken and it doesn't shut off. So slowly it starts creeping up to 75 degrees and then 80 degrees and then 90 degrees. And before you know it, it's 100 degrees all the time. And that's what happens in diabetes. And that happens throughout our body, affecting every single body system. So as I was alluding to, how does this progress? Well, diabetes is a terribly insidious disease, and you don't sort of just wake up one day and say, gosh, I think I have diabetes. What really happens is, like most diseases, we are born or with a certain set of genetics that can be protective against developing diabetes, or they can predispose us to developing diabetes. And so often from the medical community, we hear the terms, well, this gene is associated with X disease. This is an X disease gene. And I think that's very misleading, because what we are learning, particularly through emerging sciences like epigenetics, which look at how our environment turns on our own genes or turns them off, what we find is that whatever combination we may be born with the exception of what turns out to be a very minority of the diseases, something like Down syndrome, where your genetics determine that yes, 100% you will have a manifestation of Down's syndrome when you're born. Almost all the diseases are some combination of genetics and lifestyle. And the good news about that is it means that we have some control over it. And so, whether you're born with a predilection for or against developing type 2 diabetes, your lifestyle is going to play an important role in that. And over time, again, depending on the lifestyle, which has a major input over time, you may develop something called prediabetes. And it's often referred to by other names. Things like metabolic syndrome is one thing you may hear it called. And what's important about this is that diabetes is a spectrum. So it's not a light switch that goes on and you sort of have all the risk or none of the risk. It's a world of gray. And as you live longer with metabolic disease, with pre-diabetes, your risk of all the complications of diabetes, eye disease, kidney disease, heart disease, GI disease, etc., that risk continues to increase. The bad part is the symptoms of people when they have pre-diabetes is very non-specific. You might feel tired. Well, who the heck doesn't feel tired now and again? You may have a headache. So people often have pre-diabetes and are not at all aware that they are at risk. And in fact, when we look at what are some of the major risk factors in bad outcomes or morbidities and mortality with developing complications from the COVID-19 infection, one that emerged at the forefront was unrecognized, untreated, undiagnosed diabetes. And what happens is that as we go on with this metabolic syndrome condition, it will one day manifest. And when I say manifest, that means that people, often show up in a diabetic ketoacidosis, in renal failure. Uh, Many times, particularly in my world as an interventional cardiologist, is folks will present with a heart attack. So the very first manifestation of type 2 diabetes may be something as life threatening and as life changing and as serious as the saying goes as a heart attack. Well, once that manifests and we diagnose that the person has type 2 diabetes, we go into treatment. And obviously, the very first forms of treatment that we often do, particularly for patients that I see, just like the other night when I went in and treated an emergent heart attack, turns out the person had just retired, 1 week ago. They showed up after trying to do some water skiing with a heart attack. And lo and behold, they were also diagnosed with diabetes at the time. They had no idea that they had been living with prediabetes probably for many decades. Right now, our treatments focus on pharmacologic treatments, and then from there we have a resolution. So people can either progress in a state of ongoing disability, which leads to complications, start losing limbs, lose eyesight, increasing suffering, morbidity, often associated with an early death, or we can strive to achieve some reversal of the diabetes. And is this an important problem? Is it, something that we need to pay attention to? Absolutely. Just to give you an idea, I know COVID's been in the news for all the appropriate reasons, but what went under the radar and what went under the radar even before the COVID pandemic was the diabetic pandemic, obesity, diabetes, and all these diseases. And to give you an idea, the lives lost to COVID in 2020 were on par with the lives lost to diabetes in 2020. It's estimated that diabetes causes about 12% of all the deaths in the United States and other industrialized countries. And that makes it a major cause of morbidity and mortality, along with heart disease, for which it's a big risk factor, which is the number one killer of folks. And that's followed by cancer. But diabetes is definitely up there. And in fact, when we look at some of the more recent statistics from the United States, we see that there are almost 35 million people who have diabetes. But even of more concern is the over 85 million people who are pre-diabetic. As I mentioned, they're in that phase where they probably are unaware that they're at risk to go on and have some manifestation, some complication related to type 2 diabetes. When we think about that, we're looking at almost a third of the population of the United States either has diabetes or as at risk in terms of being pre-diabetic. And when we look at the charts, what's scary about this is that no country on the face of the earth as of yet, once we start seeing that rise in obesity and diabetes, has been able to reverse the curve. And so that means that in the near future, just less than 20 years away, we may be looking at over 640 million people worldwide diagnosed with type 2 diabetes. And that's not only a huge cost in terms of personal suffering for the individuals with the disease, the hardships on their families in terms of having family members suffer with this, and oftentimes requiring caregivers. But there's a huge economic impact in terms of lost productivity, and also in terms of just health costs for pharmaceuticals and for these folks that then have to undergo procedures, etc. So, despite all this sort of gloom and doom and the black crepe I've been uh, hanging, there are some bright points. And so, 100%, I'm going to work my way down here, down this list, left to right. When we look at lifestyle and when we look at people eating a modern Western diet, and by that I mean eating 60% to 70% of their food that is ultra processed food, there is no question with the data that we have. There is a 100% correlation between the amount of ultra processed food you eat and your risk of developing diabetes. No question. Case closed. That's been actually, there was a study published just a few weeks ago that showed the very same thing and showed that when people eat lots of these ultra processed foods, they are in fact often suffering low level infections that eventually go on and lead to the development of type 2 diabetes. And I mentioned, type 1 diabetes, and obviously this talk we focused on type 2 diabetes. Why is that? Well, one, obviously the link between the diet and type 2 diabetes, but 90 to 95% of the cases in this country and around the world are type 2 diabetes. And 90%, and if you're not sitting down, you probably need to, 90% of the cases of type 2 diabetes are preventable with lifestyle modifications like a culinary medicine approach to food. And I can tell you, if I had a pill that I could sell and it prevented 90% of cases of type 2 diabetes, this lecture wouldn't come from me working on the road in a hotel room. I would be giving you this lecture from my yacht somewhere in the Mediterranean. So, this is a powerful, powerful medicine and data. And you may say, well, that's all well and good for all the people who have prediabetes who haven't had type 2. But what do we do with all the folks who already have diabetes? Can we reverse that diabetes? And the answer is yes. Looking at the studies, anywhere, on average 60 plus percent, ranging from about 49% up to about 80%, depending on the studies that you look at, of patients who undergo lifestyle modifications, including addressing their diet with a culinary medicine type approach, reverse their diabetes. And you heard me right. I am talking about a reversal. And adopting a lifestyle like this, a dietary pathway that's based on culinary medicine principles, well, that's good for everyone in the family, because out of everyone in the population, whether you're diabetic or not, a culinary medicine type approach to diet is estimated to be able to address about 80% of the heart attacks that we see in this country. Again, cardiovascular disease being the number one killer in the United States. And yet, this also comes from the Mayo Clinic. There's no cure for type 2 diabetes. Well, thank you, Debbie Downer. That just kind of puts a stamp on it. Why even bother? Just take your pill and go on. This is like sort of a death sentence. And we have to look a little bit closer. Why is it that we are not addressing these very effective, very efficacious modalities like diet, like activity, to help people uh, in terms of preventing diabetes and in reversing diabetes? Well, there's a couple of big ones here. One, I could tell you, certainly I look at my colleagues in this day and time of COVID, the healthcare system is stretched. Healthcare providers are overworked. And also, I want to preface this by saying these aren't excuses and they're not recriminations. And this is done in a very non judgmental way. But if we're going to change our perspective, if we're going to look at how to adopt these, then we have to look at what our roadblocks are in a very honest, open conversation. And the time uh, allotted for providers of all levels to work with patients in things like activity, on things like diet. That's not the way our healthcare system is based, is built. And as I mentioned, it's a very stressed healthcare system as it is. And the fact of the matter is, hospitals, they don't make money if you're not sick. So, in teaching you how to eat and teaching you how to be active and teaching you how to stay out of the hospital and out of the doctor's office, other than showing up once a year for a wellness check, they're not making money. So there's very little interest in pursuing that. Pharma is pretty self-explanatory, folks. I know from firsthand experience, they are more than happy to invest money in screening, looking for new customers, as it was, have zero interest in things that don't involve you taking a pill. Do some people need medications? Absolutely. Are they important in the acute setting? Absolutely. In medicine, Western medicine, a lot of times is very simple: stop the bleeding, put out the fire. That often means drugs. That often means pharmacological therapy, but that is not a life sentence. And that's what the data is telling us. And so, while pharma is selling you the cure, you have, and I mentioned in terms of diet, the ultra processed foods being produced by agribusiness, by industrial food, big snack, big soda. These are proprietary foods that are designed to make you crave them and consume them. That is not a judgment. That is what these people do. It is a business. Farmers feed people, conglomerates feed stockholders. And industrial food is meant to feed, the wallet, to feed the coffers. No judgment there, but we have to understand, what their focus is. It's not in our best interest. They're not out there for our health, nor do they claim to be. And finally, it's about you as an individual. So, culinary medicine, the way we teach it, this is about empowering people, empowering individuals, and returning, possibly, through you voting with your own economics, returning the power of your own health through your food experience to you. And I didn't want to get bogged down in the weeds, but in the last minutes that we have, I do want to share one example, one study. This was published in 2019, so it's less than 2 years old. It's very current. It was published in a British medical journal, so it wasn't Chef Dr. Mike's, backyard collection of interesting things. The study was important because it looked just at getting rid of ultra processed foods in a Dutch population. So it didn't look at a bunch of confounders like stopping smoking or exercising. The results were achieved in only 6 months. So this wasn't a study that looked back over 10 years, waiting a decade to see if there was any benefit. The benefits were immediate, and they were powerful. So at the end of 6 months, the everyone who started the study that was on insulin, 15% of those patients who were on insulin didn't have to take it anymore. That's huge. Almost 50%, 49% of all the patients in the study were able to at least decrease their use of medicine after only 6 months. So we don't even know what it would have been like after a year. And over one in five, over 20%, were on zero medicines at the end of 6 months. So we know that interventions just like culinary medicine alone, without adjunctive things, are very effective in preventing and reversing diabetes. So can we stop this with and address this with non-pharmacologic means? You bet we can. And so this is kind of my dash to the finish here as I wrap this up in the next minute or two. It's diet. So we want to eat delicious food that is sustainable because we love our meals, but it's all about making choices that steer us away from those ultra processed alternatives. It's about activity. You don't need a personal trainer, although that can help. You don't need to go to the gym 5 times a week. You don't need to do hours of exercise. Studies show just, 15, 20 minutes of walking a day makes a huge difference in increasing the preventive effects of this approach, these lifestyle modifications. So just getting up and being active instead of sitting your rump in a chair for 8 hours a day. Stress reduction, we talked about this, and you can go back to some of the webinars. I think they were in January and February. We looked at mindful eating as ways of stress reduction and all the benefits that they have. And this is something we often don't talk about in medicine, yet the studies tell us how important the quality of our relationships are. So it is important from a medical perspective to be happy. And the relationship we have with food, it's the gateway to our relationship with our environment, each other, and this planet as a whole. And those relationships form the foundation for all the other relationships in our lives, and thus, help determine whether we have a life in which we experience health, wellness, longevity, and happiness, or we have one that's about dealing with disability, disease, and despair. So I think we are right on time. So I'm going to end this now and stop our share and put this on. Just put my video back on, and there we go. So I think we are good. I want to thank everyone for attending. I think we've used up our allotted time. Am I correct, Brianna?
That is correct.
Okay, well, great. So I hope you enjoyed this. If you wanted to look at the studies and stuff, it'll be on our YouTube channel, which I hope you'll subscribe to. All our monthly webinars can be found there. And as I said, if you have any requests, anything you'd like to hear about next month, just let us know. Till then, take care. Thanks for tuning in. Appreciate everybody's time. Cheers, mates.